Hi friends, once again welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Superintendent exam. Also, these questions will helpful for your MHSRB and other nursing officer exam preparation. Today we are discussing questions from OBG. Our first question is, the transmission of infection from the mother to the fetus through placenta is termed as. Options: Option A, iatrogenic. Option B, nosocomial. Option C, teratogenic. Option D, fomites. Our question is, infection which is transferring from mother to fetus through placenta is termed as teratogenic infection. Here option C is the correct answer. And the second option is nosocomial infection. Nosocomial infection or healthcare associated infection which is occurring from the hospital during the time of hospital stay or other healthcare related activities. Okay, that is known as nosocomial infection. Another one is iatrogenic infection. Iatrogenic infection means infection which is occurring after any medical or surgical procedure, that is known as iatrogenic infection. Move on to the second question. As the nurse enters the room of a newly admitted primigravida diagnosed with severe preeclampsia, the client begins to experience a seizure. Which action should the nurse take first? Our options: Option A, insert an airway to improve oxygenation. Option B, note the time when the seizure begins and ends. Option C, call for immediate assistance. Option D, turn the client to her left side. Here the question is, a primigravida woman is admitted to the hospital with diagnosis of severe preeclampsia. The nurse just enters this patient room and she found that the client or she begins to start seizure. Okay, what action does the nurse do first? Immediately the patient or she started to experience seizure. So what is the first nursing action? Here in case of preeclampsia, the principle of emergency management begins with calling for assistance. So as a nurse, she should call assistance for help. If the client begins to have a seizure, the first nursing action by the nurse is to remain with the client and call for immediate assistance. Okay, so here the correct answer is option C, call for immediate assistance. Then after seizure, the client need intensive monitoring. Okay, so then after that the nurse can start for airway, improving the oxygenation and turn the client to left and all. After that, after seizure activity, we can start this. The main thing is principal management is call for immediate assistance. Move on to the next question. After administering hydralazine 5 mg intravenously as prescribed for a primigravida client with severe preeclampsia at 39 weeks of gestation, the nurse should assess the client for which complication? And our options: Option A, tachycardia. Option B, bradypnea. Option C, polyuria. Option D, dysphagia. Hydralazine is an example of vasodilator. The most common adverse effect of this hydralazine is tachycardia. So the nurse should assess the client heart rate while giving hydralazine, and also after giving hydralazine also nurse should check the heart rate of the patient. So here correct answer is option A, tachycardia. So after administering hydralazine to a preeclampsia patient, the nurse should assess the tachycardia of the patient. Move on to the next question. For effective fetal blood circulation, the nurse should advise the pregnant woman to take rest in. Options: Option A, supine position. Option B, left lateral position. Option C, right lateral position. Option D, foot end raised position. Our question: for effective fetal blood circulation, the nurse advised the pregnant woman to take a rest in left lateral position. Option C is the correct answer. Move on to the next question. During fetoplacental circulation, the shunt between two atria is called. Options: Option A, ductus venosus. Option B, foramen magnum. Option C, ductus arteriosus. Option D, foramen ovale. During the fetoplacental circulation, the shunt between two atria is called foramen ovale. Option D is the correct answer. Move on to the next question. Oxygenated blood enters the fetus circulation from umbilical vein via options. Option A, ductus venosus. Option B, ductus arteriosus. Option C, intrahepatic vein. Option D, intrahepatic artery. In fetal circulation, umbilical arteries carry deoxygenated blood and umbilical veins carry oxygenated blood. Here are question. Oxygenated blood enters the fetal circulation from umbilical veins through some veins only, that is ductus venosus. Option A is the correct answer. Move on to the next question. Following an eclamptic seizure, the nurse should assess the client for which complication? Options. Option A, polyuria. Option B, facial flushing. Option C, hypotension. Option D, uterine contractions. Here the question is, which complication does the nurse should assess after eclamptic seizure? Here we can see, after an eclamptic seizure, the client commonly falls into deep sleep or coma. So the nurse should continuously monitor the client for signs of impending labor, because the client will not be able to verbalize that contractions are occurring. So after eclamptic seizure, the nurse should continuously monitor there will be occurrence of contractions. So here the correct answer is uterine contractions, because there may be chances of premature birth. So the nurse should continuously monitor for uterine contraction. Option D is the correct answer. Move on to the next question. Hypertrophic sebaceous gland present around the nipple during pregnancy is options. Option A, Montgomery tubercle. Option B, sebaceous cyst. Option C, colasma. Option D, linea nigra. Hypertrophic sebaceous gland present around the nipple during pregnancy is known as Montgomery tubercle. Option A is the correct answer. And the next question. Fothergill's operation is done for options. Option A, cervical tear. Option B, cervical cancer. Option C, uterine infection. Option D, uterine prolapse. Fothergill's operation is done for uterine prolapse. Option D is the correct answer. Move on to the next question. How the glomerular filtration rate affected during a normal pregnancy? Options. Option A, decreases by 25%. Option B, increases by 25%. Option C, increases by 50%. And option D, no change. Our question is GFR, whether the GFR will affect the pregnancy, or if affecting means how it affect the pregnancy. That is the question. So the correct answer is GFR will increase by 50%. Option C is the correct answer. Move on to the next question. Which nutrition deficiency during pregnancy causes spinal cord anomaly? Options. Option A, folic acid. Option B, calcium. Option C, iron. Option D, zinc. Our question is, which nutrition deficiency during pregnancy may cause spinal cord anomaly or neural tube defect in babies? It is due to the deficiency of folic acid. Option A is the correct answer. Move on to the next question. Early amniocentesis is done in which week of pregnancy? Options. Option A, 6 to 10 weeks. Option B, 16 to 18 weeks. Option C, 11 to 15 weeks. Option D, 9 to 11 weeks. Here the question is early amniocentesis. Specifically they asked, it is early amniocentesis is done in which week of pregnancy? It is done between 14 to 16 week of pregnancy. In our question, 14 to 16 coming between 11 and 15. Okay, so here the correct answer is option C. Normally, amniocentesis is done between which week of pregnancy? If it is asking means it is 15 to 20 week of pregnancy. Here, early amniocentesis means it is between 14 to 16 week. Move on to the next question. An amniocentesis test cannot be performed before 14 week of gestation because options. Option A, fetal heartbeat is heard. Option B, the fetus is not mature. Option C, amniotic fluid is not enough. Option D, the genetic result may not be accurate. Here the question is, why amniocentesis test is not performed before 14th week of gestation? Because this amniotic fluid amount is not enough. So here the correct answer is option C. Then after 14 weeks till 20 weeks of pregnancy, this amniocentesis is doing. During this period, the amniotic fluid volume is adequate and many viable fetal cells can be present during this period. So amniocentesis is performed after 14th week of gestation. Move on to the next question. Average weight gain during pregnancy is options. Option A 9 kg, option B 10 kg, option C 11 to 13 kg, option D 15 to 16 kg. The question is average weight gain during pregnancy. It is between 11 to 13 kg. Suppose if the question is normal weight gain during pregnancy, in our option 11 is there, means that will come correct answer. Okay, so 11 to 13 kg, here the correct answer option C. Move on to the next question. During which week of pregnancy lightening can be felt by the mother? Options. Option A 34 weeks, option B 36 weeks, option C 38 week, option D 40 weeks. Lightening can be felt by the mother. Lightening means head is coming down. Okay, it is felt by the mother by the weeks of 36. Option B is the correct answer. Move on to the next question. Which test is commonly used to find the number of motility and activity of sperm? Options. Option A protein electrophoresis, option B microphoresis, option C PCR test, option D Herner test. The test which is used to find out the number of motility and activity of sperm by Herner test, option D is the correct answer. Move on to the next question. Uterine artery is a branch of options. Option A abdominal aorta, option B femoral artery, option C external iliac artery, option D internal iliac artery. Uterine artery is the branch of internal iliac artery. Option D is the correct answer. Move on to the next question. Vaginal pH during pregnancy is options. Option A acidic, option B neutral, option C basic, option D fluctuating. Normally from puberty vaginal pH is acidic, that is 4 to 5 is the pH of vagina because of lactic acid which is produced by Dorderland bacilli. Here our question is the vaginal pH during pregnancy. During pregnancy the pH is about 4.5. It is acidic. So here our correct answer is option A acidic. Move on to the next question. The uterine fundal height of a pregnant woman is at the level of umbilicus is about options. Option A 10 to 12 weeks, option B 14 to 16 weeks, option C 22 to 24 weeks, option D 30 to 32 weeks. Our question is, when did the fundal height reach at the level of umbilicus? It is about 22 to 24 week. Here we can see 12th week of pregnancy. After 12th week fundus is just above the pubic bone, just above the symphysis pubis. At about 16th week, the fundus can be located halfway between the symphysis pubis and the umbilicus. And at 20 to 22 weeks, the fundus can be located at the level of umbilicus. Okay, and at the 36th week, the fundus is at the level of xiphoid process. Here, which week the fundal height of pregnant woman at the level of umbilicus? It is about 22 to 24 weeks. Will come correct answer option C. Friends, here we discussed important and previous year questions from OBG. Surely these questions will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle and subscribe my channel also.